was particularly interested in what happened when the mind so-called went wrong. Like, what was that? What is schizophrenia? What is psychosis? What is it when people get these kind of paranoid delusions or the hallucinations? Like, what actually is that? So there was one main issue with it, was that most of the drug treatments that we used weren't that effective. And it's not that I'm anti-drug, against drugs and against pharmacological treatments, not at all. I think there's definitely a role for them, especially in safety. So if people are unable to guarantee their own safety, if they might take their lives or they might harm somebody else, it may well be that you need to use a pharmacological treatment. And I think that they can be used for safety in that domain. But in general, the psychological treatments that we had, the pharmacological treatments, just weren't that effective. So antidepressants and treating depression and anxiety, they were never supposed to be used long term. So actually, when they were first synthesized, when they were first invented, they were described as being these things that you're supposed to take for a few months, and it gets you out of a bit of a rut until you can treat the root cause of your problem and move on. But unfortunately in psychiatry, that didn't happen, and we ended up using a lot of these drugs long term. And so I began to get more and more disillusioned when I was working with our patients, and it became more and more frustrating and upsetting. It became really upsetting actually seeing clients come in, especially like young people, like in their early adulthood, and knowing that if they had a diagnosis of schizophrenia, that was pretty much going to be it. You know, we might be able to help them a bit, but if they were coming back in a few times with schizophrenia, a lot of their lifetime was going to be spent in and out of psychiatric hospital. And I really struggled with that. I really, really struggled with that. And all of them were saying the same thing, saying how it was real medicine. And then when you go to the witch doctors, what they do, it's true, and it's not just, make believe.